One of the things we talked about is this thing called the triple aim. Mm-hmm. So let me try to
what is it?
Let me try
the whiteboard.
Let me try to visually discuss that on a radio show. So imagine a triangle, and on one end of the triangle is something called the patient experience. So that's one of the corners. On the other corner of the triangle is something called cost of care, and then on the third angle of the triangle is something called population health. And that's what healthcare organizations need to do. They need to work towards goals in all three of those areas. So we need to be able to provide the best patient experience. And that means, customer satisfaction. That means high quality care.
Right.
That means easily accessible care. The other thing we need to do, though, is while we're doing all of that, we need to lower our cost. And quite frankly, that's something we've been working on for quite a while. But the game is getting, I think, more significant, and we're going to have to significantly improve our performance. We do well now, but we have opportunity. But the real change is that third end of the triangle, something called population health.
Thanks, Shannon.
And currently, we're paid organizations. Healthcare, quite frankly, makes revenues by people coming in the door. So the more people you come in the door, then there's more revenue coming into the organization. Well, now the organization is going to be responsible, all healthcare is going to be responsible for the health of your community. And our job is to make sure people get the right care at the right place at the right time. And what it also means is that expensive care, that a care that really occurs in the hospital, is going to have to start decreasing. And we actually have to be and will be incentivized, instead of filling the beds in our hospital, we'll be incentivized to actually start keeping those beds empty. So that's a big change. That's a fundamental cultural and system change that we'll be going through. You ask about the Affordable Care Act. Well, the Affordable Care Act is clearly significant in much of this, but at the same time, this is where healthcare needed to go anyway. I think all of us in our communities really need to have the best care, and we really should not be incentivized for getting people to be sick. We should be incentivized for really keeping people well.
So, immediately I want to say, Yakima Regional Gymnasium. You start paying for. How do you keep communities safe, healthy? Through gym memberships, keeping them out there active. How does that happen?
So quickly, this is Memorial, not Regional.
I'm sorry, my fault. Memorial Hospital.
So you hacked in this morning, Tony.
Yeah. Well, I'm sorry. I've got that on my mind. I apologize.
So let me
Memorial Gymnasium.
So Lance, let me give you an example. So diabetes, obesity, childhood obesity. Really, I think if you talk to people in healthcare right now, they're going to say that the next major disease that healthcare will be dealing with is diabetes. And so what are we doing about that? Well, it really turns out to be you need to do things around education. You need to explain to people how they should be eating versus the way if you go out to eat in restaurants right now, it isn't really healthy eating. And so we are now educating people on how to make healthy choices. And there are some very structured classes going on right now with a number of individuals who are either pre-diabetic or diabetic, and we're basically changing their lives by just educating them. And that's just the tip of the iceberg. There are many other things that you'll see us get involved with in the future.
It's very interesting, Russ, that we had some of your class coordinator types in a week or two ago talking about dealing with chronic diseases and the kinds of lifetime changes that need to be made. And
it goes into a lot of different areas. Diabetes prevention. Our ACT program is trying to address those children who are at risk for obesity and diabetes.
And here's the thing. In addition to that, it's a more stressful world. I read an article yesterday preparing for today that said 45. If you work in a stressful office, your chances of getting diabetes are up 45% because that stress will change your lifestyle choices, which funnel you straight towards what is a controllable circumstance, diabetes.
Yeah, when you're stressed, you reach for comfort food.
That's right. It's like if I can't get my hands around Lance's neck, it's around a maple bar. You know what I'm saying?
But we have to teach people that comfort food is broccoli.
I'm bringing donuts next time.
Maple bars.
We seem fixated here. Well, I think the triple aim is really good. It's going to be interesting to see, though. It's kind of like farmers being paid not to grow something in a way. As a kid who grew up on a farm, that's kind of, it's like if there was too much, wheat out there, then, we leave wheat acreage idle and the government helps in that regard. Well, if we're trying to, how the hospital will be able to monetize and stay in business with a goal of making people make good, healthy choices long before it ever comes to a hospital circumstance. So how are you going to pull that one off? I mean, I'm a magician. I'm waiting to hear your answer on this.
So, we have about 2,400 employees. We're the largest employer in Yakima, in the Yakima Valley. And our intention is to stay that way. But what it means is you reallocate. So what it means is you put services on the outpatient side and not on the inpatient side. So a good example now are the Healthy Nows that are going up. There's one here in Creekside. There is one in East Valley. We'll be putting some others up around 72nd. And that's to provide readily accessible primary care so that before you go to the ER or before you go into the hospital or before you get too sick, you can address those things and it's easily accessible. And those are the kinds of things that I think that are going to be coming in the future. In the future, you're going to see apps, quite frankly, on how you can contact a primary care physician and start talking about, some concern that you may have around your health, and they deal with it, via your computer.
See, Kev, your do-it-yourself appendectomy app. There may be a future for that. Keep refining, keep fine-tuning. There's hope. Well, I tell you, it is the world of medicine is changing, and we see all this stuff being done online. These goofy ice challenges for ALS research. Have you done one of those yet, Russ?
I haven't.
You haven't yet. Okay, you hear that, Yakima? But finding ways to fundraise for research to get ahead of. Are we spending enough, in your opinion, out there on the research side of finding diseases to help you in this battle of keeping us healthy before we ever get into hospitals?
So where healthcare is, it's in the gap phase right now in this system transformation. So we're currently still very much in the fee-for-service, more people through the door, and we're transitioning more towards that manage the population health. And I'd say at this point, we are right in the middle somewhere. So we're getting some money spent in those areas, but it still hasn't made that full transition.
Got a ways to go. Well, and that's, talk about an exciting time for you as a manager to be able to, I got you, buddy, to have that as your responsibility to help bring in the new day of medical care for the Valley. Good thing you had all those years under the previous administration is to get a good sense of what we did, and now you got a great launch pad for where we need to go. So,
and we have some great young leaders who are figuring it out for us right now.
Got some good people there. That's the nice thing about it. Russ Myers, good to see you. Thanks for coming.
Thanks.
Don't
Dave.
be a stranger. Forget the donuts. You got Shannon. She'll keep me straight. That's all good. Hey, Fox News is next. Lance has your local news right after that here on 12.